It's my absolute pleasure to start this conversation with Helene. Mend is actually one of our resident companies, and it's my privilege to see their journey unfold over the past few years. So, Helene, I wanted to dive right in. We know that nurses are the unsung heroes and also the care backbone of our healthcare systems. But right now, given the pressures that we are all very familiar with, they're stretched. And I think Mend right now is providing an alternative that's really intriguing. So can you introduce yourselves, Mend, and just the journey that you recently started?
Sure, absolutely. Thank you so much, Glennis. I'm really happy to be here talking with you. So I have spent my entire career in the healthcare industry and saw that really a patient-centered focus has been lacking. And Men started out as a clinical nutrition company and really focused on providing functional nutrition to doctors for specific patient needs. But we realized that particularly in the orthopedic space, this is a moment when patients are open to change during this acute episode of care, but they don't really have the tools or the education or the training to really optimize their experience. And nurses are the key to that. So procedures like joint replacement and surgery that Mend is focused on really benefit from the right nutrition, both before, during, and after the procedure, but also guidance and instructions on how to use the products, and also remaining compliant. And in fact, in all my years in healthcare, I know that patient compliance is one of the key factors to improving outcomes. And it starts with engagement. And engagement really only happens when it's designed with psychology and patients really understand, what's in it to them. How can they really improve their own outcomes by having agency with what they're doing? And with nurses, I found also that the best insights come from the people closest to the patients. So I created a care team model that works with nurses and nutritionists as the front line with the patients, with human first interaction through multimodal telemedicine. And this way, patients develop this personal relationship with their coaches. And we also have the ability to customize their care. So it's a win for the patients, for the caregivers, and it gives frontline workers like nurses much more flexibility in their life, a lower stress environment. And we find that it's really, really rewarding for them as well.
And how are you selecting nurses, and what's the reception been like as you try to recruit and also advance your talent acquisition model?
Yes, so naturally nurses have characteristics that are really great for this role. So we know that they're collaborative, empathetic, flexible, but specifically to transition to this telemedicine role, there are other characteristics that we look for. So they have to have technology adaptability. And in fact, one of the kind of interesting ways for selection, and it is personally interviewing them, is I always ask on a scale of 1 to 5, with 1 is you have a flip phone and 5 is everything to do on your smartphone. Where do you sit in the spectrum? So when we ask nurses that, as long as they're around a 4, we know that they're going to be able to adapt and pick up the technology that we're looking for them to use. But we also look for nurses who are good at self-management and scheduling, because with telemedicine, it's really important to be efficient about your time, because obviously you're having that, interaction with the patients in a real-time basis, but it's required to document and have those case notes and to, have everything that's necessary to pull it back into the healthcare system, particularly for reimbursement.
Yeah. And what's really interesting is that you, as I understand it, you're working with a demographic that's not necessarily technology savvy, and you're curating nurses that are technology savvy. So do you provide significant training? How do you bridge that gap between the patient and the nurses in terms of their embrace of technology and innovation?
So this is a really interesting fact because at first we thought, if we're looking at an older demographic of patients, is this even going to work? Because our solution requires smartphone use. So, and also access to the internet. So we have data transmission. And what we've found is that there's a much higher adoption of smartphone usage of the older demographic than we thought, but there is limited use of, some of the features and functions. So we find that as long as our nurses can get everything set up, starting and running, and we actually have a care team model where we provide, technical support as well. Once the patients are locked into a routine, their compliance is really good. It's more getting over that frustration of setting things up. And once that friction has been resolved, we find that, especially SMS, everyone knows how to send a text message. So we've designed it to be super easy to use just once we get that initial implementation done.
Yeah. And in terms of, I would imagine that it's relatively attractive for nurses to join your team and have a more flexible work schedule. But what are the other benefits that you're seeing the nurses that are joining you articulate in terms of transitioning out of the clinic and more into this remote telehealth platform?
So I think one of the things that's super important to mention is that investing in nurses is just so important, not just for them, but that it also makes good business sense. So for nurse well-being, when you have happy nurses, it's because they have more balance in their life. They're able to, manage their schedule and not have, the type of long hours. But these happy nurses then stay longer. We have less recruitment costs, less turnover, and then we can invest in the training. And because the training is part of human capital, it increases their skills, their efficiency, so they can provide better care, reduced errors, and better cost control. And all of this leads to the nurses getting a sense of accomplishment and pride. So they're able to know that they're contributing at a higher level. And we're really interested in the factor of nurse innovation. Nurses are problem solvers. And because they're on the front line, in traditional roles, they're not always listened to. So in a role like we have, they contribute to our solutions and improving them. And they're really insightful in terms of how to get to better care.
Yeah, I think that's a tremendous, tremendous point that you're making. Nurses generally are dealing with a hierarchy that, we're all familiar with, and having them utilize all of the experience and with the resolution of the experience they're having, I think it's quite impactful. In terms of the additional benefits and the information and insights that you're getting from the nurses, how are you capturing that? And also, how is your platform leveraging that interaction between the nurses, the patient, and capturing the data for outcomes? Are you also using technology, or is there some other system in place?
Yes, absolutely. So we're really focused on the nurse interaction, improving engagement. So we, have the ability to see how the patients are interacting with the nurses, the messages that they respond to, and starting to segment the patients in terms of what types of contact they like. How frequent, what format, and then, what's important to them, and then those critical points in their care. So at different points of the journey, there's more or less interaction needed. So when we establish that relationship at the beginning and understand how they like to communicate, then we know that when we get to those critical moments, we're really giving them the access to the information in the way that's going to best optimize their outcomes.
Okay. And I wanted to touch on the business model a little bit. I know that Mend has transitioned into telehealth from being nutraceutical and clinically validated products for your patients that are going through recovery from surgery. And as you navigate this new territory, what have been the important anchors of this new business model in terms of the nurses, but also some of the data that you're collecting?
So we have multiple stakeholders, and I think that a lot of digital solutions have issues because of the question of who's going to pay for the solution. So basically, in what we've provided is a benefit to our hospital partners. And we have also leveraged insurance codes for reimbursement. And in that way, we're able to provide support to patients basically for the cost of a copay. So, so we're looking at a model where we're sharing the benefit with our hospital providers, but also not increasing a financial burden to the patients.
Okay. And are you seeing changes in compliance and outcomes?
Yes, absolutely. These are the feedback that we're getting from our patients is that the personal interaction is what has given them information they never had before. We've had situations where patients were really not on track to be successful or to cancel their surgery, and the reduction in reschedule and cancellations of surgeries because we were able to maintain them in range has been a measurable outcome.
Okay. And just one final question here. I'd love for you to touch on scalability of this. And I know it's early days, but what do you consider to be advantages and also hurdles that has to be addressed as this model gets scaled?
Sure. So the key to scalability really is profiling your patient population and understanding what are those, let's say 20% that require more care. And that way we're able to automate more of the responses when it's not critical. So that's why I mentioned, at certain points in the patient journey, it's absolutely critical that we have, contact and we're getting them through that time. But then the other times when it's less critical, we can use a less high touch and lower cost way of interacting with the patients. And that's the key to scalability.
Okay, that's great. And in terms of the patients, as the patients are navigating through your system, there's a pre-surgical component, as I understand it, and there's the post-surgical component. Are you maintaining the same nurse, the same individual interacting? So is that a one-to-one relationship? And is it the relationship with the patient and the nurse, or the patient and the brand? What are you focusing on in terms of your marketing and development there?
So we absolutely introduced the concept of the care team early on because it's frankly not practical to ensure that we're going to have the continuity of the same caregiver for the full 6-month journey. So that relationship, even though it's formed with, one person one-on-one at the beginning, then in our care team model, we have on our platform, there's visibility to the case notes for each patient so that any member of the med care team can have the full information and be able to flexibly go between patients. So it is, to your point, the relationship with the brand, because we've built trust, and the trust starts with the individual, but then extends to the other members of the care team.
Okay, great. And in terms of the family dynamic, how much? So you're dealing with older patients, and I'm sure there are additional members. Is there interaction with just the patient, or are you also engaging in a more wider community or household?
So that's actually an interesting pre-qualification. So when we look at patients that are eligible for the program, they have to have agency. So for example, patients in nursing homes or assisted care facilities are excluded because we need them to be able to plan their own nutrition. However, family members are often the ones who, I mentioned that part at the beginning where they have to activate their technology. Many times our care team is talking to their children, getting help, setting things up. So the members of the family are absolutely part of that whole care ecosystem. But technically our care team can only interact one-on-one with the patient. But knowing that family dynamic and understanding the psychology of care and the social support that the patient has also allows us to focus on those that are isolated. They need more contact and more help. And that comes to that stratification of the patient population that I mentioned before.